Hi, Jerome Fryer of Dynamic Disc Designs. I had a patient yesterday that was trying to understand her random symptoms. And it was difficult for her to understand where her symptoms were coming from because they would kind of wax and wane but there were some predictable things. She couldn't walk for a certain period of time. And then in order to relieve her buttock pain and her leg pain, she would have to sit. Ding! That should be suspicious, that make you suspicious that there's a spinal stenosis component associated with it. So lo and behold, I looked up her CT scan, evidence of encroachment in the central and lateral aspect of 5-1, 4-5 as well. But she didn't understand why her symptoms would come and go. She did like chair yoga. So remember that using the models is a very powerful tool in helping patients understand their symptoms. So they can start to understand what to do, what not to do in order to give them the best therapeutic resolution. You call it therapeutic, it could be at-home exercise or just basic understanding of their own anatomy. So professional model, right? I'll show you how I quickly helped her understand her symptoms. She says she's been to countless other practitioners. Okay, so professional model, remember this is removable, so you can take out the cauda equina, pen, spinal canal, right? Right, show her, look at the clearance, wonderful clearance, right? Take the lumbar spinal stenosis model. You can take out the cauda equina if you had it included in your order, but you can see that the spinal canal is narrowed. Push this pen up through the spinal canal, patients can feel, oh yeah, there's a little friction. Then tell her to move this back and forth and extend the model, and now it's come tight. Right? Simulating her understanding of when she walks for a period of time. They may not get it right away, right? But orient the spine, and when they walk, right, all of a sudden the canal tightens up, and so the nerves do in the corresponding spaces. Then flex the spine, right? And then all of a sudden, right, there's spacing increased. Similarly, get them to understand when they sit, it creates flexion, opening up the spinal canal, right? All of a sudden now they understand why walking is symptomatic and why sitting tends to relieve the symptoms. So, wonderful comparison. Lumbar spinal stenosis model, and you take the cauda equina out of the professional model. Now they can see why their symptoms wax and wane. So I hope that's helpful.